Well, hello, it's Bruce Williams, and today it's time for Gross Pathology Challenge 41, which we're going to do in the traditional short answer format. Before we get started, I want to thank all my friends and colleagues who provided me fantastic images over the years from which I can choose to put these challenges together. Go ahead and get out your pens and your papers, and let's begin. For slide 1, this is tissue from an ox. Can you give me a morphologic diagnosis, the cause, and appropriate etiologic diagnosis? Okay, time's up. We're looking at 3 sections of skeletal muscle, and the normal part is the reddish part. The abnormal part is the dark red to black part. The condition is known as blackleg. The morphologic diagnosis is multifocal coalescing necrohemorrhagic rhabdomyositis with emphysema, and you have to have the emphysema in there because it's very characteristic for clostridial infections and for blackleg. And if you look very closely, you'll see the little bubbles here in the muscles because this agent's a gas producer. The cause is Clostridium shovii, an appropriate etiologic diagnosis which contains 2 words, the organ and the agent. In whichever order sounds better to you, will be clostridial myositis or muscular clostridiosis. Remember that the body of cattle is not sterile, and spores of Clostridium shovii are prepositioned throughout the body, in the muscle and the cardiac muscle, just waiting for appropriate times of ischemia where they can proliferate and cause damage to the animal. Maybe the animal gets an injection or traumatic injury. Or in some cases, we don't exactly know why you get blackleg in the heart. I think it has something to do with times of stress, catecholamine release, and excessive exertion and beating of the heart muscle. But they all get it. If you cut into this muscle and you smell it, it smells like sort of rancid butter. It has a very characteristic odor to it. Okay, slide number 2 is from a rat. Can you give me a morphologic diagnosis? Take a moment and see what you can come up with. Okay, time's up. We're looking at a bicornuate organ, which is the uterus, in a rat, and there are multiple projections from the wall into the lumen of the uterus. These polyps, these are either endometrial polyps, they can be straight endometrial polyps, which are polypoid projections of the epithelium, or more likely they are endometrial stromal polyps, and the balance of these polyps is composed of uterine stroma. Endometrial stromal polyps are not an uncommon finding in older female rats, so that's one for you to remember. Okay, slide number 3 is from a 3-month-old calf. Can you give me a morphologic diagnosis for this one? Okay, time's up. The age of this animal was important because this is a neoplasm that is seen in very young animals, especially calves. It's often seen in the area of the 4th ventricle, just in front of the cerebellum. This one seems to be a little bit rostral. It appears to be thalamic in origin. It is elevating the cerebrum, which is sort of flattened on top because of the size of this neoplasm. And when you tell me it's a 3-month-old calf, about the only thing I'm going to be thinking about in this particular area is a medulloblastoma, classic neoplasm, which is from the family of the primitive neuroectodermal tumors that's seen in young calves. Slide number 4. Slide number 4 is tissue from a sheep. Can you give me a morphologic diagnosis and a cause? Okay, time's up. We're looking at the dental pad. There's a focally extensive area of ulceration on the dental pad, and this is pretty classic for the disease blue tongue. The morphologic diagnosis would be focally extensive necrosis of the dental pad. The cause is ovine orbivirus. Now, when we're talking about ulceration of the oral cavity of sheep, I guess I have to accept a couple of other possibilities. So I'm not going to budge on the morphologic diagnosis, but if you said that this was pestis du petit ruminant caused by an ovine morbillivirus, which can cause respiratory and GI problems, the GI problems generally being ulceration throughout the GI tract, I'm going to give you full credit. If you said that this was ovine pestivirus, yes, there can be ulcerations with the pestivirus. It certainly doesn't get the play that bovine pestivirus does, but ovine pestivirus can cause diarrhea and occasionally ulcerations. So I think I'm going to give you full credit for that too. I don't expect many people to throw that one out, but orbivirus or morbillivirus I think would be acceptable answers for this particular presentation. Remember that ovine orbivirus, the causative agent blue tongue, will also infect cattle as well. The disease is often not as severe, but if it infects the developing fetus, you can have significant developmental brain defects, including hydranencephaly, depending on the time that the window in which the fetus is infected. Okay, slide number 5. This one is tissue from a pig. Can you give me a morphologic diagnosis and a cause? Okay, time's up. This is one of those classic lesions. It's a diffuse necrotizing colitis. If you took a histologic section, a lot of times the gross appearance of the colitis is a lot worse than the histologic appearance, where it's often very superficial. Sometimes they go all the way through, but a lot of times it's just a superficial mucosa. But it does infect the entire mucosa, and this has been classically described. I don't think it looks too much like it, but some people say that it looks like a Turkish towel, which I think is just a regular old bath towel. The appearance looks like a Turkish towel, but the yellowish green color lets you know that there is necrosis. There is what used to be called a diphtheritic membrane, and necrotic mucosa often terms sort of a yellow-green here. The classic cause of this is Brachyspira hypodysenteriae, the causative agent of swine dysentery, and that's fine. If you said Brachyspira hampsoni, that can also mimic Brachyspira hypodysenteriae. That was a great paper that was written by Bailey Wilberts at Iowa State a number of years ago. And if you mention Brachyspira pilosecolia, the causative agent of swine spirochetal colitis, it's usually a little milder, but I think I'd probably give you credit. There aren't that many other Brachyspira. Brachyspira innocens is also seen in pigs, but that's considered non-pathogenic. So I'm taking Brachyspira hypodysenteriae and hampsoni for full credit, and Brachyspira pilosecolia for a raised eyebrow. Okay, slide number 6 is tissue from a penguin. A penguin, how'd that get in here? Well, it must have come up from the South Pole. And I want you to give me a morphologic diagnosis. Okay, time's up. We're at here the back legs, here's the base of the tail. There's a large mass arising from what is known as the preen gland. The preen gland is a modified sebaceous gland that the animal reaches back there and gets some oils on its beak, and then it rubs it on its feather, so it secretes sort of a greasy substance. I guess if it was it's what my kids call product. They put product in their hair. So this is where they get the product for their feathers. But unfortunately, sometimes they turn into neoplasms. You could have called this a uropygial or a preen gland carcinoma for full credit. They often also will throw squamous cell carcinomas out of this gland. So because it's a mixed squamous and sebaceous gland, it can look a little bit like either. So either uropygial squamous cell carcinoma or uropygial carcinoma, I'm perfectly happy with. Okay, slide number 7 is tissue from a calf. I want you to name the condition and give me the cause. Okay, time's up. We have a calf here with a very large head, very short legs, and the head is so small that the tongue cannot be contained. It looks like it was born alive, but I'm not going to take off any points on this because this is a fairly small point. These are traditionally known as Dexter Bulldog calves. Okay, the Dexter is a short breed of cattle which has been genetically bred to be very small. The people like that have like very small farmettes, like maybe a half an acre. So they want these very small calves. But the problem is they're often chondrodystrophic. They have defects in the aggrecan gene, which is a gene, and the abbreviation is ACAN. It's the aggregan gene, AGGREGAN. Now, the small point I was talking about is this animal's born alive. Most of your Dexter Bulldogs are more severely affected. They are usually stillborn. They will often have, in addition to severe chondrodystrophy and severe craniofacial abnormalities, they may have hernias or something like this. This would probably fall into the category of a snorter calf. You can imagine why they're called snorters, or a telemark, which are animals that are often born alive, but because of these significant defects don't live very long. Okay, you can imagine the problems with even retracting the tongue. So it's truly a telemark or a snorter. But if you said Dexter Bulldog, that's what everybody sort of dumps them into. I think that's fine. Slide number 8 is tissue from a mouse. Can you give me a morphologic diagnosis? Okay, this one shouldn't take you so long because, as I always say, if you see a big liver and a big spleen in a mouse, just go with lymphoma and you would be perfectly fine. This one also has a big lymph node as well. The only other thing that I would possibly entertain might be histiocytic sarcoma. Maybe that's 5% or less of these, but a big spleen, big liver, even if we didn't have the big mesenteric lymph node. You can't go wrong with lymphoma. Most lymphomas in mice are caused by the endogenous retrovirus mouse murine leukemia virus. They all have it in their DNA. They're just sort of waiting for the right genetic mutation to develop lymphoma or to develop mammary tumors, which are in there as well and are extremely common. Some strains, like AKRs, may have 100% incidence of lymphoma, particularly they have thymic lymphoma by the age of 18 months. Nude mice very commonly get lymphoma. You think, well, nude mice don't have any lymphocytes. How could they get lymphoma? Well, they do have lymphocytes. They just don't work very well. So their monitoring system for lymphoma is bad. So when they have a clone go bad, which a normal mouse probably take care of immediately, well, they die of lymphoma. So don't think because nude mice are immunodeficient, they're not going to get their share of lymphomas. It's a major cause of mortality in nude mice. Slide number 9. Slide number 9 is tissue from a dog. Can you give me a morphologic diagnosis and the cause? Okay, this one took a lot of thinking, and for some of you, you may have never have seen a urine sample, a spun urine sample from one of these animals before. Okay, we have a kidney from a dog with significant white stripings and an overall tan color to the cortex. That's not a normal looking cortex. Whenever I see a golden tan cortex, I think either of glomerulonephritis or some form of toxicity. And I don't know if you can see this, a little bit of reflectivity in there. This is what you would see in an animal that has been poisoned by antifreeze. And what we are looking at in the urine is small oxalate crystals. They tend to fragment up. You don't see the nice fans. If you look histologically at this particular kidney, you're going to see beautiful oxalate crystals, the fan or shell-shaped crystals that accumulate within the tubules, and they form and they rupture and they cause necrosis of the tubular epithelium. They occlude urine flow, and this renal damage only happens if the animal survives the acute problems associated with ethylene glycol, when the alcohol dehydrogenase in the liver breaks ethylene glycol down into glycolic acid and glycoaldehyde, which causes a severe acidosis in these animals. If they survive then the oxalate will combine with calcium and you'll get crystals. And yes, they do get passed in the urine. You know, they form in the tubules, so they'll pass in the urine, and you can see them, and they look very much like this, and they are birefringent. If you take a section and you polarize it, or you polarize the sample, it's going to be beautifully birefringent. Okay, one more. This is tissue from a calf, obviously from the collection of Dr. John King. Can you name the condition and describe the histologic lesion? Okay, time's up. Well, we got a couple things going on here. We have an animal that appears to be walking on its hocks. And then it also has a large linear tear of the skin right here in the abdomen. And that's because the animal has a condition known as dermatosparaxis. It's a correlate of Ehlers-Danlos type 7 in humans, and it is a collagen production and packing defect. And hence, the collagen in the tendons of the legs is improperly made, and so the joints are extra flexible, and the skin has little collagen, which is improperly complexed, and so the tendrils of collagen are usually very thin, and the skin tears very easily. Dermatosparaxis, and if you describe a histologic lesion, collagen dysplasia resulting in loose collagen packing and abnormal fibrils. This is one that we've gotten a number of these over the years, and people just send in a biopsy of the skin. They say, can you diagnose Ehlers-Danlos or dermatosparaxis or cutaneous asthenia? They all come in basically the same condition. We've had them in dogs and in wild hoof stock and all sorts of things. And it's very difficult without an age-matched control. And you'll look at it and you'll say, I think it's too thin. Then you put it on EM, looking for the collagen, looking for the periodicity, and it can be a very frustrating diagnosis without the submission of an age-matched control. But if you have some sort of crazy kudu or something, that's 2 months and its skin's ripping, nobody's going to say, okay, well, we've got to euthanize this healthy kudu over here so we can prove that this one's sick. So it's been sort of frustrating over the years to try and diagnose this. But certainly there are a lot of cattle and sheep out there, certain strains of sheep. This genetic defects runs high in. So cutaneous asthenia, dermatosparaxis, Ehlers-Danlos, I would probably take all of that for this one. Okay, well, that brings us to the end of another Growth Path Challenge. We got it in within 20 minutes, and that's a good thing. I hope you enjoyed it. I hope you'll come back for more. I'll try and mix them up and give you some more multiple choice ones for those of you who are preparing for your ACVP exam. and continue with the short answer for those of you around the rest of the world who are trying to get a handle on some of this interesting pathology, or even just review some of these wonderful cases that have come in. Hey, I hope everybody has great health, and I wish everybody a wonderful weekend. I'll see you next week with another Growth Path Challenge.